Feeling good about yourself, both inside and out, is an important part of living a confident, productive life. So to learn more about how we can build self-esteem and put forth our very best appearance, I've come to Gaines Plastic Surgery to talk with Dr. Gregory Gaines. Let's go find the doctor. This is a really attractive facility. How long have you been here?
Well, I've been practicing in Gainesville since 1995, but we only moved to this facility in 2012. We have 2 on-site operating rooms, which make things much more convenient for the patients, also much more private.
When it comes to becoming a plastic surgeon, there's a lot involved.
Most of us as plastic surgeons are first trained as general surgeons, typically a 5-year residency. Many of us are board certified as general surgeons and then go on to train as plastic surgeons, which is another residency, and then frequently there's fellowship training beyond that.
So you're very well qualified, I say. So what types of procedures are you able to perform here?
Typically are a kind of elective cosmetic plastic surgery procedures that most people are familiar with, like facelift, breast augmentation, tummy tuck.
How does someone know if surgery is a good option for them?
Call in, make an appointment, and we'll bring them in to talk to them and find out what is it exactly that they're uncomfortable with, what is it that they might like to change about themselves, and if it's something that we can accomplish, that we can determine by sitting down in the clinic room and talking through these things.
So if someone decides surgery isn't right for them, are there other options available?
Absolutely. There are plenty of procedures we perform here in the clinic. Injectables such as Botox or Juvederm, some of the fillers that you've heard about. What I think makes us stand out from maybe some of the other practices around is these are procedures here that are administered by the physician. These are things that I do.
I was getting wrinkles on my forehead and around my eyes, little crow's feet. Dr. Gaines in our initial consultation told me about how my muscles work and what actually forms the wrinkles, and we came up with a plan of action to use a little Botox and fillers. I have so much more confidence. I feel ready to take on the world.
Typically when we think about cosmetic surgery or plastic surgery, we think about appearance and aesthetics, but you actually do quite a bit more than that.
At least half of the procedures we perform, if not more, involve restoration of form and function rather than appearance. Those would be things like reconstruction of breast for women after mastectomy for cancer, reconstructive procedures for lower extremity after open fractures or soft tissue loss there, burn reconstruction for burn patients, or public may not understand, plastic surgeons probably do half of the hand surgery that's done.
You also work with hair transplant. Why did you decide to go into that field?
That was something that we learned in my training during residency, and not many people realize is one of the areas of plastic surgery that's enjoyed some of the greatest improvements in both technique and outcome in probably the last decade.
I've just never been very comfortable with my hair loss. I'm only 5 months into the frontal portion, and it's unbelievable the results we've gotten.
Plastic surgeons can actually help with migraine headaches. Is that true?
That is true, actually. There are patients that we've been aware of for several years that respond nicely to Botox injections in certain muscle groups, the forehead and the face, that get nice relief from migraine symptoms. And what we figured out, there are muscles in that we can treat surgically for a more permanent and lasting resolution of these symptoms.
Talking with some of your patients, they have all said, hands down, that what they really like about working with you is that you take the time to educate them, give them their options, and allow them some ownership in these decisions.
He spends a lot of time with his patients.
Dr. Gaines is very adamant about me being educated as far as how this works.
An informed patient is definitely an asset. If patients understand where it is we're trying to arrive, generally they can help us to get there.
What are you waiting for? Put your best foot forward with Gaines Plastic Surgery. For more information or to see some incredible before and after photos, go to GainesvillePlastics.com.